Jesus is the answer for the world today. Above him there's no other, 'cause Jesus is the way.
Today we're going to be talking about drug addictions. Now, how are those addictions different than other addictions? Well, the first thing is, when you put drugs in your body and in your brain, they mess up your brain, which is a chemical computer. See, don't ever get this idea that you get something for nothing. And we're going to see that. What you do is you artificially stimulate certain things, or you fill certain receptors, or you increase certain neurotransmitters, and when you do that, it's going to have an effect. And so every time, see, consider that maybe your emotional levels and everything are going about like this. Well, if you artificially do this, what's it going to do? Do this. So we're going to see that when you play around with these things, you're really playing with trouble. But even more than that, your body adapts to these things. And so it says, oh, I've got that, so I don't need to do this now. And so it adapts to it, and you're basically just taking your brain and throwing all the chemistry off all over the place and causing all sorts of havoc and all sorts of problems. There are a lot of ways of doing that. You know, what is this sort of like? Well, just a few months ago, I had a kidney stone. And so, what do you think they gave me for the pain of the kidney stone? Loratab. And of course, that's a very addicting drug that we see people addicted to it all the time. So I was smart enough that I got off it as fast as I could. But I could tell you that even though I had a lot of pain, if I had enough Loratab, life was sort of good for me. You know what I mean? Well, that's why people do these kind of things, is because they can have short periods of their time where life is sort of good for them. The problem, of course, is what it does to the rest of their life eventually, and how this thing eventually takes over their entire life. Here are some statistics. These are pretty recent statistics. 8.3% of people in the United States use illicit drugs. 6% of the people in the United States use marijuana. 2.8% use psychotherapeutic drugs. In other words, drugs that are actually for a particular reason that you get prescribed, but they're using them illegally. Painkillers, 2%. Cocaine, 1%. Methamphetamine, 0.3%. Hallucinogens, 0.2%. Heroin, 0.14%. The highest use is between 18 to 25-year-olds. Now, what does the Bible say about drugs? And we have to think about this. How many ever found a verse in the Bible that said, "Thou shalt not take drugs"? But there are words in the Bible that mean the same thing, and they're translated in different ways, because the Bible is very clear on this particular subject once you understand the words. And again, what do we have to do? Go to the Greek and see what the Greek is really telling us here. The word we're going to look at is pharmakeo. Now, what does that word normally mean to us? Where does it come from? Pharmacy. That's where we get our pharmacy from, isn't it? But the way it's translated in the Bible is as sorcery or witchcraft. Because in those days, the people that did mess around with drugs and so on were the sorcerers that were trying to get this feel of what was going to happen in the future, or the witches that were trying to control other people. So that's why in your Bible, that word, which really means drugs, is interpreted that particular way. Let me give you some verses where that word is used. Galatians 5:20, when it's talking about the manifestations of the flesh, it says idolatry, witchcraft, hatred, variance, emulations, wrath, strife, seditions, heresies. And that word witchcraft there is pharmakeia. So it's really talking about drugs. Then Revelations 9:21. Neither repented they of their murders, nor their sorceries. Guess what that word is again? Pharmakeia. Nor their fornication, nor their thefts. And then Revelations 18:23. And the light of the candle shall shine no more at all in thee. And the voice of the bridegroom and of the bride shall be heard no more at all in thee. For thy merchants were the great men of the earth. For by thy sorceries were all nations deceived. And again, the word is pharmakeia. So do you see, it is in the Bible. It's just, you just have to look at what the words are that it is really talking about there. And it was not to be happening in Israel. Deuteronomy 10:18. Let no one be found among you who sacrifices his son or daughter in the fire. That was worship to Moloch. Who practices divination or sorcery. Again, the sorcery is the drugs. Interprets omens, engages in witchcraft, or casts spells. So we actually have it in two different places in that same verse. And who is a medium or a spiritualist, or who consults the dead. Anyone who does these things is detestable to the Lord, and because of these detestable practices, the Lord your God will drive out those nations before you. Now let's look at another example of that. I said, although they didn't have a lot of things, they did have certain things that acted like drugs. This is Jesus on the cross. Matthew 27:34. They gave him vinegar to drink mingled with gall. And when he had tasted thereof, he would not drink. What was the idea there? The pain that the people had, this is the way they assuaged some of the pain with the gall that they put in the wine that they would then put to the person that was being crucified. The Bible also tells us, 1 Corinthians 3:16, don't you know that you yourselves are God's temple and that God's Spirit lives in you? If anyone destroys God's temple, God will destroy him. For God's temple is sacred and you are that temple. What kind of drugs would that be referring to? How about stuff like nicotine? You know, that basically takes years off your life. Other things that we put into our bodies have a negative effect on us. So how do drugs work? It's not as simple as alcohol. Remember, alcohol was pretty simple. How fast your blood alcohol level rose was the effect that you had in your body. Now, it was affected by how much you weighed and stuff like that. But in drugs, it's a much more complex thing because drugs work in a lot of different ways that we sort of understand a lot better now, but we're not understood at all. First, it depends on what function they have. Obviously, painkillers work a very different way than, say, cocaine or heroin works on the person's brain. The environment that they're taken in can have a big effect. Have you ever heard of the placebo effect? Even thinking that something's going to help you can actually help you when it has no effect whatsoever. It's based on specific molecular, psychological, physiological, and biological chemical changes. Like, for example, atropine occupies the acetylcholine receptor sites, and that's what causes dry mouth. Our brains are very, very complex things. We have all these different receptor sites on different parts of your brain. And whatever this chemical locks into is what part of your brain gets affected. And you have different neurotransmitters in different parts of your brain. So the effects are very, very complicated of all the kind of things that go on. Non-specific factors, individual expectation, mood, personality, can have a big difference. How many of you ever heard of an LSD trip? How come some people have good LSD trips and some people have bad LSD trips from the same drug? Because it interacts with the other stuff that's going on. The dose and time factor. Many times you have to reach a certain blood level, which means you have to take a particular drug for a period of time before you get the high. Another one is if you take a drug, let's just say crack cocaine. You're never going to get that same high again from crack cocaine. And the reason is your body adapts to it. And it changes the number of receptor sites. And so now it takes more to get the same thing. That's why we have tolerance, is that when you put a drug in, the body reacts to that drug and it does other things in your brain, and those other things in the brain then make it so it doesn't work as well. Body weight, gender, age, individual receptivity, adverse reactions. Another thing to realize is that it's a very dangerous thing you're playing with. That's why we have overdoses. You have the effective dose, the ED, and the lethal dose, the LD. And so therefore, if you take a little bit too much, it kills you. Cumulative effects. Ever hear of time-release drugs? Yeah, it can be released over a period of time. Otherwise, what happens? It spikes, and then it comes down. Method of administration. Injection. Intravenous is the fastest onset. Oral. Inhaling. And you have a thing called a blood-brain barrier. That means to protect your brain, there's a barrier that filters out and doesn't allow certain types of drugs to get into your brain. But of course, the ones that people are going to use probably to get the high and to medicate themselves are ones that go right through the blood-brain barrier. There are side effects to every drug. Mechanics. It can deal with the cell membrane, the neurotransmitters, and it can affect synthesis of the neurotransmitter, storage of the neurotransmitter, reuptake of the neurotransmitter, or release of the neurotransmitter. How do antidepressants work? SSRIs. Selective serotonin reuptake inhibitor. That's what it means. That's the most used type of thing like Prozac and so on for depression. What's it saying? It's saying what it affects is the cell makes the neurotransmitter, then after it uses it, it picks it up and destroys it. That's called reuptake. So what it does is it stops the cell from picking it up again. So it just puts it out there, puts it out there. And of course that's because you're destroying the neurotransmitter by what you're thinking. By your depression, by your stress is what's destroying the neurotransmitter. So you don't need to destroy it, so that way they can artificially have your body make more and more neurotransmitter until you feel okay. So do you see the complications of all this stuff? So it's very hard to say what effects you're getting in a particular thing. And of course there are receptor sites for opium, and there are neuropeptides. Those are things you get the cell and it goes through your body, goes through the blood, goes to your brain and hits certain receptor sites. And that's how a lot of this stuff works. And so there are all different places of where these things can affect you. Then we have what's called drug deactivation. Either removal or chemically changed. Your body tries to fight all this stuff and tries to work all this junk that you're putting in your brain and in your body out, so it filters some of this stuff out. That's why it drops off after a while. Tolerance, caused by activating more enzymes which break down the drug or due to chemical changes. Pharmacodynamic, tolerance due to nervous tissue balancing of the drug required for withdrawal. So there's all this stuff going on in your body. So don't think you can say, well, this drug, this just does this, and this is the only effect it's going to have on me. Just realize it's affecting your body, and your body's going to adapt to it, and how much your body adapts to it is going to affect everything else. So what are the types of drugs that we have today? The first category we're going to call stimulants, and they reduce tiredness. What's one of the real mild stimulants? like caffeine. But do you know that caffeine works just the same as cocaine? In fact, if you take too much caffeine, you can cause yourself to have panic attacks. That's why if you ever have anyone that you're dealing with as panic attacks, ask them how much coffee they're drinking. And get them to quit drinking coffee or caffeine drinks. Amphetamine. Of course, this is speed or meth or crank. And by the way, it's good to know those little street terms, because you get somebody calling in and they're saying, I'm just high on crank. You say, you're... I actually had that happen to me one time because I didn't know what crank meant. I had to ask the person what the crank meant. Used to stay awake. It dilates the bronchial tubes, deals with narcolepsy, hyperactivity, and appetite. It can have a paranoid effect. In fact, if you get somebody that comes in and they're saying, as an example, one of my clients that came in, everyone is pointing lasers at me. Every place I go, they're pointing lasers at me. Don't you see the lasers? Of course, you're talking about laser sights from guns. No, he was just in a paranoid state from all the meth that he was using. And I had to talk him down. Violent behavior. A lot of murders are caused by the violent behavior that comes from meth. Compulsiveness, repetitive actions. The half-life is 10 to 12 hours. That means it'll come down to half of its power within 10 to 12 hours. But of course, what do? You just keep taking more and more and more. How do people get hooked on this stuff? College? Work? You want to get something done? Remember when I was in the Air Force, that they gave amphetamine to the pilots because they were flying from here all the way to Europe. And so if they got tired, rather than have them crash the plane in the ocean or fall asleep, now when they got to the other end, they had to turn in any extra ones that they had left. It works by stimulating the norepinephrine neurons. You can have physical dependence, withdrawal, and you crash, or several days of depression recovering from the drug, and crash again if you take it again, the drug, in about 2 days. You can't maintain the high. What happens, they just use it, now they're coming down for the depression, so they use it again. And then they use it again and use it again. And pretty soon, they end up paranoid. They end up in the psychotic state. And you're going to get that. Most psychotic states that we see are from meth or cocaine or crack. If they just keep using it, at some point, they're going to be in psychosis. How do you administrate it? Orally or intravenously? It's very interesting, though, what it does with ADHD. This is the drug that they use, and it actually takes a hyper ADHD kid and calms them down. Now, exactly why that happens, I don't think people exactly know. One of the theories is that what's really going on in ADHD is that they are really tired and they have all that activity to keep themselves awake. So now if we give them something to keep themselves awake, they don't need to do the activity. Another thing interesting about meth, if you didn't know it, it'll destroy your teeth. If you ever see a client that's carrying a toothbrush, that's what they're supposed to do. Every time they use meth, they need to take a toothbrush and clean their teeth, or you're going to see somebody with all their teeth just rotted out. Cocaine. It's a stimulant, a lot like meth, a little bit different in the way it works. It comes from a cocoa plant. It replaced amphetamines in the 1980s as the abusive stimulant drug of choice. The method, it blocks the reuptake of norepinephrine and dopamine, which is a neurotransmitter, and attaches to specific serotonin neurons. The half-life varies from 20 minutes to 2 hours. Notice that when we compare that to meth. It's used as a local anesthetic. How do you administer it? By almost all different ways. Intravenous, smoked with a free base, with ether, Crack, that's where it's mixed up into a hard crystal type of thing. Snorting, chewing, or sucking. Cocaine poisoning. If you ever see some convulsions, respiratory or cardiac arrest, withdrawal or depression, people die of overdoses of cocaine. Rapid dependence, very, very fast. High in only a few minutes, followed by depression. Very high relapse rate. I know people that have been in a number of inpatient treatment programs that they might last 6 months and they're right back on cocaine again. So it's very, very dangerous. Those are the main drugs you're going to see as stimulants. Okay, now depressants, downers or sedatives. Alcohol is a depressant, so it's extremely dangerous if you mix alcohol with any of these drugs. That's where a lot of people die, is because drugs have a synergistic effect, which means it isn't just you get the effect of the alcohol and the effect of the other depressant, you get more than that. And so that's extremely dangerous. If you have a client that's on depressants, ask them, are you drinking? Because if you are, you're really playing with some really dangerous stuff here. Of course, they take it to reduce anxiety, take it as sleeping pills. They're barbiturates. There are 2,500 different ones. And they do have tolerance, and they do have physical dependence. Then there's meprobiamate. This is like Milltown. Physical dependence if you double dose. Then we have benzodiazepines. That's like Librium or Valium. How many of you have ever heard of Valium? Another drug people really get hooked on. It's not physical. They don't have physical addiction to Valium, but you have psychological dependence. Methaqualone. It's known as a wall banger on the street, physically or psychological dependence. Of course, older adults on prescription drugs and younger ones use it to get high. Narcotics. They're usually opium derivatives. Morphine. In the Civil War, because they were amputating legs and arms and all this kind of stuff, and they used morphine, a lot of the soldiers got addicted to the morphine. Codeine. Heroin, the best known. It's about 3 times as potent as morphine, and faster because it can penetrate the blood-brain barrier easier. Therefore, it's the most addicting. Ever seen a movie or something like Crossing the Switchblade where somebody was coming off heroin? It's like a week of just throwing up and just excruciating pain and everything else, just beyond imagination. And because of that, we have another problem. The problem is if the person is on it, even if it's not doing anything for them, do they want to come off it? So they will take it to just not have to go through the withdrawal. Works by activating opium receptors. It causes endorphins to be released. What do endorphins do to you? Make you feel happy, make you feel good. That's why they use it. It's used as painkillers for diarrhea, as a cough suppressant. Physical dependence and withdrawal with anxiety, perspiration, runny nose and eyes, pupil dilation, tremors, flashes, aching bones, muscles, insomnia, vomiting, and diarrhea. Doesn't that sound great? Both positive and negative reinforcement. When I was talking about that, that's negative reinforcement, where you're just taking it to not go through the withdrawal. Takes about a week to get hooked on it. Patterns of abuse, ill for 48 hours after use, if they quit using it. So why do they always have to? Once you use it, you've got to get more and more and more and keep using it, or you go through the withdrawal, or you're going to be feeling terrible within 3 to 4 hours. This causes the most damage outside of alcohol. Remember I told you that alcohol is the most physically damaging drug there is? This causes the next most amount of damage to your body physically. Pulmonary edema. That's where the water goes into your lungs. Asthma, quinine toxicity, thrombophlebitis, clotting or swelling of the veins. Hepatotoxicity, jaundice from liver breakdown. Myalgia, muscle pain or arthritis from buildup of salts. Nephropathy, kidney disease. Thrombocytopenia, shortness of blood cells. Myelopathy, disease of the bone marrow. Damage to the nose and the lungs. All of those kind of things you can get by using heroin. How about hallucinogens? LSD, odorless, colorless, tasteless. One of the most potent drugs known, rapid tolerance. You don't become dependent on it. It's actually unknown except of why it causes this, but it binds to the serotonin receptors, expansive and restrictive reactions, flashbacks, intoxication in the first hour, perception changes of the self in second hour, including depersonalization. So basically, you don't know what it's going to do, but this gives you all sorts of experiences, those trips that I was talking about. Then you have the Mexican mushroom. That's very similar to LSD, does the same kind of thing. And then you have catechol hallucinogens. This is mescaline. This is what the Native Americans used to use to try and get their visions and so on and so forth. It comes from the peyote cactus. Causes nausea, vomiting, convulsions, hallucinations, and sometimes respiratory failure. And then amphetamine derivatives, STP, MDA, MDMA, PCP. Those will make you much more disorganized thinking, suspiciousness, uncooperativeness. Anticholinergic hallucinogens. They come from the potato family, believe it or not. They block acetylcholine receptor sites, delirium, mental confusion, and loss of memory. And finally, Amatia mescalaria, a Russian or Scandinavian mushroom. Drunkenness, hallucinations, partial paralysis with extended sleep. Wouldn't you like to have all those things in your life? And why in the world do people use them? Again, we said because you're medicating your emotions, it makes you feel different, but the effects end up in all of these messes and all these problems that a person has. And of course, we need to talk about cannabis, don't we? Marijuana. Let's talk about that a little bit, because that's used, and most people that get arrested for using marijuana. It has some sedative effect, pain relief, hallucinogenic effect at high doses. There are more than 400 different chemicals in marijuana. That's why you can't really figure out exactly what it's doing, because it's affecting your body in so many different places. It comes from the cannabis plant. THC is the active ingredient, and it remains in your body for a long period of time, over a week, sometimes up to a month. That's why usually when they do drug testing, who are the ones they usually catch? The ones who have been using marijuana. Because a lot of the other drugs have a lot less half-life than that, so they come out of the body faster. Many effects: stimulation, feeling of well-being. Of course, that's why people use it. Introspection, tranquil, mood changes, loss of short-term memory, up to 206 different effects that the person gets. They have to learn to use it. They can get turned on just by thinking about it. It's used for glaucoma and reducing nausea. Those are the positive uses of it. Physical dependence is possible. Panic reactions at high doses. The best treatment is talking somebody down. Withdrawal, depression up to 12 weeks. Cancer producing, decreased testosterone, Amotivational, that means one of the biggest things you're going to see, if you've got a client you just can't motivate and they just don't seem to care about anything, find out if they're on marijuana, because it takes away the person's motivation. Impaired learning and relational problems. Another one is, see, people say, well, that's not as bad as alcohol. Alcohol affects your large motor skills. This affects your small motor skills, which means you don't really see it as much. It just means, like in a driving test I saw one time, where they took people, marijuana doesn't bother me, I'm just fine, thanks. And so they would take them and have them run through this obstacle course. And then they would let them smoke some marijuana and have them run through the obstacle course again. What do you think they found? They were knocking over the cones all over the place. But they thought they still had done a good job. Do you see the problem? Because it changes the way you think. It messes up all these kind of things. And of course, as we said, there are all these different prescription drugs that people get on, and they're very good and they're useful for painkillers, but you can get addicted to them, like Loratab, Percocet, things like that. Painkillers. Drug therapy. What are the differences? One is that sometimes you're going to have to get detoxification in a hospital because they're hurting so badly and they're so hooked on this stuff that when the body comes off it, as an example, a person that's been on heroin and the horrendous stuff they're going to go through coming off this, it's best if they're watched by a physician and they watch their blood levels and all this kind of stuff to actually get them off it in the first place. They're usually more driven to get the drug. In other words, their entire life becomes focused on this. Where the alcoholic might only drink on weekends. Remember, you have to have it every 4 hours. They're going to steal, do whatever they have to do, prostitution, whatever it takes to get this drug, because they're so driven to have this over and over again, and it totally consumes their life. They'll do anything. Withdrawal fear can lead to the negative reinforcement. Again, you kick up, you're going down, so now I have to take some more. And it gets you in this whole cycle that you can't get in. And it's a physical cycle. And you can get on binges lasting for days. There was this one particular client that I had. She was bipolar, and when she got in the manic phase, she would disappear for like 3 days in a crack house, spend $1,000 on crack until she got settled down. What's it like to be addicted to drugs like this? Consumes all your waking moments. That's all you think about. The only thing that matters. Terrible withdrawal. You're totally trapped. Destroys and consumes all of your life. So let's ask a question here. Should a Christian be taking drugs? Only as prescribed by a doctor. Could we agree? But the Bible is very much against this. It sees witches and sorcerers, which is the word pharmakeia, as people totally against God. They're to be totally eradicated from Israel and killed. Because what's it doing? It's destroying the temple. It's taking up that very complex chemical computer that we don't even know what all it does and how it works, and you're just throwing a bunch of chemicals in there and they're doing stuff, and who knows what they're really doing in the long run and what kind of problems that this is causing. And of course, why do people do it? Again, to medicate their emotions, to medicate how they feel, to escape, something like that. Should a counselor use drugs? Well, same thing we said about alcohol, right? Bible says don't make your brother stumble. And so obviously if you think you can handle it, and of course all drug addicts think they're the only one in the world that can handle this stuff, and it doesn't cause them any problems, right? No. But again, you've got to decide. That's up to you. But I think the case is very clear. Let's pray. Lord, we thank you that you have given us these drugs because they're very useful medically in many areas in our lives, and we ask that you would help us to use them correctly as you design them to be, for good and not for evil, for gain and not for destruction. And we ask, Lord, you would give us wisdom in dealing with clients like this to help them to see the right way of using these wonderful gifts that you provided for us. In Jesus' name, amen.
Jesus is the answer for the world today. Above him there's no other, 'cause Jesus is the way. Jesus is the answer for the world today. Above him there's